Kubor, begini fliu jumut lang akan kapor. Kumno, banla, ban tem, ia kan ni kajing safriang, jong uniu kenyang jengpang COVID-19. Bat kumno ngin la ban ai, kajing yada kababaha bat kabapaka. Namata kinong song snong kijongi, ha kajalahi barok kawai. Saya sini pedang subhai fi barok, but sure ngin sedang ya kan ni. Barok koi kejelah, lamba ki media ki befair. An khot subha shaning kong ye Director of Health Services Research, Dr. H.C. Lindam, mindan lang bat ngang ni. Yai Dr. Andreas Tekhar, ibadai Joint Director, but I consultant, Surgeon Superintendent jong Civil Hospital Shillong. Yai Dr. Vijay Kumar, Vijay Nongpur, ibadai specialist nabanta kini ki jingpang badai jong Shadam, napo Negrims. Dr. Iva Shadab, ibadai jong kalain jong ka pathology, but badi pet ya ka testing center, testing jongi apo Pasteur Institute. Yai Dr. Jeremy Buam, iru idei bapet ya laboratory, but ya kiba shemi ki sample but test nam tau COVID-19. I hot yai Dr. Meban Kharkongor, specialist na po Roberts Hospital. Dr. Rajiv, who is the public health specialist. Dr. Robert, public health specialist. Dr. Dimitras Lalu, medical specialist jonga Ganesh Das Hospital. Dr. Sim Yong, ibadai napo Ganesh Das, wa idan ta po Pasteur Institute, ibadai microbiologist jongi Dr. Kharjana, ibadai respiratory medicine specialist jongi ibadan napo RPHS Hospital, but ringkat bat ngi idan lang Joint Director jongi Dr. Kharshieng, F. Kharshieng, but Dr. CD Lingdo, ibadai Deputy Director jongka Administration napo Directorate of Health Services, MI. Ms. Dang, we will start this press briefing as always with the update with regard to COVID-19. Today, the 12th of December 2020, the number of new cases today is 98, and out of this 98, 61 are in East Khasi Hills, 25 West Jaintia Hills, 6 from Ribhoi, 2 cases in East Garo Hills, West Garo Hills 2, North Garo Hills 1, South Garo Hills 1. 1 case has been transferred from West Garo Hills to East Khasi Hills, and another case has been transferred from East Khasi Hills to West Jaintia Hills. The total number of active cases is 641, and out of this 641, East Khasi Hills has got 394 cases, 48 from the armed forces, paramilitary forces, and 346 from the others category. West Khasi Hills 7, Southwest Khasi Hills 4, Ribhoi 29, West Jaintia Hills 81, East Jaintia Hills 6, I'm sorry, East Jaintia Hills 5, West Garo Hills 73, 3 from the armed forces, paramilitary forces, and 70 from the others category. Southwest Garo Hills 18, South Garo Hills 4, East Garo Hills 17, and North Garo Hills 9. The total number of recovered cases is 50, East Khas Hills 23, West Garo Hills 16, Southwest Garo Hills 4, West Jaintia Hills 4, Ribhoi 3. The total number of recovered cases till date is 11,977. We had one case of death in East Khasi Hills, and the total number of deaths has gone up to 125. The total number of persons tested till date, that is 12 December 2020 till 2 p.m., is 2,65,057. The number of persons who have tested negative is 2,52,314. The number of tests conducted on 12th December 2020 till 2 p.m. is 1,600 approximately. The number of new cases, 98, East Khas Hills 61, and out of this 61, 2 are from the armed forces, paramilitary forces, 4 are returnees, 2 police personnel, 4 are health workers, 13 high-risk cases, 1 from the Gulf Link cluster, 1 from Jayau cluster, 4 from Laban cluster, Lajmkra cluster 2, Madanrating cluster 24, Mauprem cluster 1, Nong Thamai cluster 3. West Jaintia Hills 25, high-risk 8, Yau Mu Siang cluster 1, Kim Mu Siang cluster 3, Min Thong cluster 13. Ribhoi 6, all high-risk cases. East Garo Hills 2, all high-risk cases. West Garo Hills 2, all high-risk cases. North Garo Hills 1, high-risk case. South Garo Hills 1, high-risk case. Kini gilong ujung betip kijongi, kiwedei buat COVID-19, mentah kasih khadar tarik ubenai Desember hajar arfo. Kikis kibat thamai, mentah kasih gilong kendai fufra. But nakini kendai fufra, nrifuai gidan po East Khas Hills, arfusan po West Jaintia Hills, nrio po Ribhoi, ar po East Garo Hills, ar po West Garo Hills, iwei po North Garo Hills, but iwei po South Garo Hills. Kikis barok kibalong aktif. Haru mentah kasih kilong nrio spa safuai. But nakini nrio spa safuai, lai spa khandai fusau gidan po East Khas Hills, safufra kidai niki armed forces, paramilitary forces, but lai spa safun kidai niki kiwei. New gidan po West Khas Hills, Southwest Khas Hills, Arf Khandai po Ribhoi, Prafuai po West Jaintia Hills, San po East Jaintia Hills, New Fulai po West Garo Hills, Lai gidan niki armed forces, paramilitary forces, but New Fo na kiwei. Khatpra gidan po Southwest Garo Hills, South po South Garo Hills, Khatnyo po East Garo Hills, Khandai po North Garo Hills, but kibalar cover. Hadu mentakas ni gilong San Phongut, but naginig San Phongut, Arfulai gidai na po East Khas Hills, Khandrio na West Garo Hills, South na po Southwest Garo Hills, South na po West Jaintia Hills, but Lai na po Ribhoi. Baro kibar cover, hadu mentakas ni gilong Khatway hajar, khandai spa nyo punyo. idon iwe bakhlat hapo East Coast Hills, but barok ki bakhlat kilong kelum lang kilong sispa arfusan. Ki tes ki benglale hadu menta kasi arbaje menski kilong arlak rifusan hajar san punyo. Ki belong negatif kilong arlak san fu ar hajar laispa khatsau. But ki tes ki bengile menta kasi kilong kumba khan riuspa ye kata hadu kumba arbaje menski menta kasi. Kies ki bathamai baro khandai kilong khandai pufra mendaksi nrifuai gidan po East Coast Hills but nakini ar kide ki armed forces paramilitary forces saw kide ki returnees ar kide ki police personnel saw kide ki health workers khatlai kide ki high risk case iwei de golf link cluster iwei na po jail cluster saw gidan po Laban cluster ar po Laim Khra cluster ar fu saw na po Marandating cluster iwei nan Maupram cluster but lai na Nongthamai cluster. West Jaintia Hills Arfusan high risk case kidan pra Yau Musiang cluster iwei Kim Musiang cluster lai Mentong cluster khat lai. Ribhoi district Ndreu barok ki high risk case East Garo Hills R the high risk West Garo Hills R high risk North Garo Hills iwei the high risk case, but South Garo Hills iwei the high risk case. Baklat ibangin pentip ke kerteng gajung I gede Bilenson CH moment. Prapusnam gerta Shenrang nalang kerding Nong Mensong admit I hapo Nazareth Hospital hakashputarek mentawunai but Klat no hakapor lai wije hakajuk sni. But kadau kajeng klat ni kajeng pang bidan kadai type 2 diabetes mellitus done by hypertension COPD but COVID-19 pneumonia. The person who passed away, as I've already mentioned, is Mr. Bilenson CH Moment, 80 years, male, from Langkerding, Nongmensong, and admitted in Nazareth Hospital on 10th of December 2020. And he passed away at 3 p.m. on the same day. The diagnosis given is type 2 diabetes mellitus with hypertension, with COPD, with COVID-19 pneumonia. So that is on the update today. Now, the intention of having our panelists here in the different branches of specialties is to highlight and to pass on the information to all the citizens of the state in very simple language on how to contain the spread of COVID-19, on how to prevent the spread of COVID-19, and how to protect oneself from COVID-19. Idon lang magkini ki start doctors ki jungi na ki specialty ki bafair, but ni ay menta ngin pelat menta siya fi baro ba fin bu jingkeli, but kini ki start doctor jungi kin jubah ya kini jingkeli ke bayadai bat ke specialty jungki ka jingmut jong kani kalong ba ngikwa ba kinong song snong jungi baro kawai ka jela kinyo ka jingtip ka khamba bat khambanya ka bayadai bat uni khanyang jong jingpang COVID-19 wala safrang keleng menta but ban ayengi ka jing sautu ba ka jing shai kumno ngila banyada nauni khanyang jingpang kumno ngila banyada na ka jing safrang jong ni khanyang jingpang but kumno ngila banyo pat ya ka jingim ka jongi ka bapura ka bakalong shwa jong COVID-19 but nginget skam Bahkan ni kacing sedang kacungi ya kani ke live press conference kan long kacing Arab ya baro bat ngilai penbet lang bat ki parlok kacungi na po press ba kat bala ngin live stream kani bat hakawai pat kabenta ngin la ban yo ya kacing keli na kipat ba bat kata ngidang ya pen kre ya kata bat nganget scam bahkan ni kacungi kendu kacungi mentah kasni bat hadin nang ni kan long ke jingyarap ya baro bat kandai ru hakaju kapor kaban ai kacing syai bat ya kacing tip ya baro kibadan bentalang hakani ke pandemic boleh sibuna. Now I will invite the members of the media to kindly place your queries, any queries that you have with the, and our specialists here will clarify and pass on the information for any clarifications that are needed. Thank you.
Kau ini jengkeli makwa menkeli kalong ba punsin kini nyang jengpang ki kendroi ha poliur ha por saat ini por untuk por slap ti ha jeng sisa ada kalong kunta kamut ba uni kenyang jengpang lu la de banduna mentah mal balajan ketlang ndai balai ken uni kenyang jengpang hadu mentah udang kendroi udang udang ya sekarang nang roi kabanang miksi nang sim ni jeng im Joki beliau, kita jengkeli kawan orang.
We'll take that. Vijay, take that. Huh? Okay, sure.
Yes, oi ru na i kistat ka koi kakhya ru kilaya ilai kren hai kilat pathai ku bo da bo ang ba lakum no ni khunyang jingpang desi un saja no hau punai September desi un seduna no Ndai kumolong mata kamu ikba kata kejeng ong kejeng ki kamu simat rekam pipi laban pencarian belok nikpang
hot kaba ngiu I ka compare how new knyang compare ki knyang jing pang kum kiwi virus pi min sim sem ba ka mi ning kong how 9 December kum tu kami ning kong ha China but hakatu ka jaka ka ba ngi sem ning kong itu knyang ro ka de ka por tlang he mo ka de jaka ba khriat tam hakatu ka por de di China por hakatu ka por tlang ba hakatu ka por ni kin mau ka Australia por tlang jungi sini ka Australia ka de hakapor liur mo te udan lang si po Australia tingin patla ban penyedai ka Yauni kunyang jempang coronavirus dan COVID-19 bat ka temperature. 48 hot uyap aka high temperature more than 27 degree ni more than 27 degree centigrade u ayam. Henry bat ka temperature bat ka sun beneng pada 4 dadon kata ka studies penong ba unyap aka por telang.
Cuban ya kataru ngidewan kenbang ba uni udah virus wat mai kenyang jingpang wat mai teka behavior jong ni virus tu ngiru ngidang ya study ngidang ya pet te ya kata kajing keli ko fibu ma firu ko balong valid ba jing sisa ulah de banduna kan ka por ndai ngi ba kamdan kata kajing tuna ndai kadang sapryang ndai kani kajing sapryang ngila ban tem ni kani kajing sapryang ladang ngida ngi ada ye ladi ba kita kajing ada lightly nado ningkong kemas social distancing kani physical distancing but kani ka hand sanitization kini lightly gini kajing ada kiba kong san kiba don't come tam to nakal yang joki ton okay babaji
saya ingin tu kau mendekai orang dahulu yang COVID Hindi akan tu lang bagi virus bakta iki sedang bagi belum ngila ban group iki kum kini respiratory viruses. Kini respiratory viruses nginde pet. Baru kini respiratory unlike ki jingpang ki bakam pun ke bagi kita polio. Kini respiratory viruses kum ki influenza ki other respiratory viruses ru ke incidence ki kam kio ki portalang. That is one common factor during COVID-19, but the rest of the respiratory viruses, they hold. Actually, as a matter of fact, we are expecting the that cases may rise in winter because these are all respiratory viruses. The incidence tends to increase during winters.
Bahkan dalam ini bon ki kmilunti bahkan kiwi ki cases kin kiw kini ki benai telang rei kamtam shangi kini ki jaka kriat manus nem yo iya bangi sumar ginong pang te ki ba khams ki ba sitam ha por telang ki khamjur wat lada la ban ba ngi expect ngi ong ba la ban khamduna ga kajing bon jong ki case ndai na ki case ki ba wan pat kum ba kilong ya ki jing pangru ni expect ban ngi lada syamru yang mentah ba ki ba wan ha ka portlang ki khamjur khamtam ha ki ba temen bat ki brio ki ba don lupa ki jing pang le hisin ba khiat ka sun beneng ma ba khiat ka weather bangi ong the complications jong ka jing stom kum ka shock hypothermia bahiar ka BP ke bahiar ka jing saat jong brio kata bro kapenlong ba kan kam jur su ka jing stom ban ya ki brio ki ban ya lada uju brio stom ha portalang te kadai ka boong i so DHS ba kabadan kam hi kadai vet ba nginde ban la ban kiar hi kat bala ba nginum yo hi tau jing pang ban ni ka ba perkhat balai ka bon ha ka por balai ka dangdon ha ka portalang
I'm not sure it's in Kalita.
I have one question. I would like to start by saying that our journey with COVID-19 our journey with COVID-19 has been for the past maybe nearly 10 months now, and people, they more or less they are aware of this COVID-19 now. But people of the state are looking forward for a cure. So from my side, I would like to know the preparation of the state for this vaccination program, and how far can this vaccine help to stop the spread of COVID-19?
Yeah, so with regards to the state, preparedness of the state, I think I will leave that part of the question to Director. But with regards to vaccine, now we have to understand that a vaccine is not a cure. Vaccine will help to prevent. Okay, as of now, we have, currently, there are only 4 vaccines that have crossed what we call as a phase 3 trial, where it has been done on human subjects. So just to go back, I may sidetrack a bit. Now, when we are developing a vaccine, say when we look at H1N1 or when we look at the SARS or MERS, the actual development of a vaccine actually takes 3 to 4 years. Okay, we are now just 10 months into COVID-19. It's been a tremendous effort from all the researchers around the world to actually come up with 4 different types of vaccines actually from all corners of the globe. So within a period of 10 months. Now these vaccines in their trials we all know the 4 of them. One is the Moderna vaccine, one is the Pfizer BioNTech vaccine, then we have the University of Oxford, which is the same as the AstraZeneca, and also the Bharat Serum, which is being made in India. And the last one is the Sputnik 5 vaccine. So these are the 4 vaccines that have crossed phase 3. That means they've been tested on an appreciable number of human beings. Looking at the efficacy, the side effects. And the last one is the so with regards to efficacy, almost all the vaccines show a similar level of vaccines that have crossed phase 3 of almost 94 to 95%. Now, tested on when we look at efficacy of the vaccine, since we are just 10 months into looking at the efficacy, side effects, and the last one is the so with regards to efficacy, almost all the vaccines show a similar level of data across phase 3 of almost 94 to 95%. Now, when we look at efficacy of the vaccine, since really we are just 10 months into whether the vaccine is actually effective or not. And based on the limited number of regards to based on these 10 months of research, what we see is that most of these vaccines are 94 to 95% effective in what they mean by efficacy right now is that after getting the adequate doses of vaccine for these vaccines, the course is research. What we see is that it differs from one vaccine to another, but generally 94 to 95%. You need 2 doses, effective is 10 weeks apart. And then they mean by effect of the vaccine, the protective effect of the vaccine, is getting the adequate doses of vaccine minimum for these vaccines. The course is so when we look at efficacy, that means it differs from one vaccine to another, but generally 94 to 95%. You need 2 doses, effective is 10 weeks apart to 95%. And then they mean by effect of the vaccine, the protective effect of the vaccine, is getting the adequate doses of vaccine minimum for these vaccines. Will not manifest. So when we look at efficacy, that is how we measure the from one vaccine to another, but generally that we look at how much of antibodies to 95 vaccines, and then they mean by effect of the vaccine, the protective effect of the vaccine, is getting the adequate doses of vaccine minimum for these vaccines. We are seeing that manifest. So when we look at efficacy, that is how we measure the from one vaccines are even that use we look at how much of fairly adequate vaccines, and then they mean by effect of the vaccine, that is the vaccine that we are talking about. So it is not a cure. We have to be very mindful that vaccines is not a cure. As of now, there is still no cure. There is no definite anti-COVID-19 medication, drug, vaccine, or anything that is there as such. So with regards to cure, definitely this is not. Now, we would have all read in the papers that there are among these vaccines. Now, when it comes to side effects, there's a lot of fear of side effects among these vaccines. That's the most important thing. Now, yes, that is definitely a gray area because we don't have the long-term data to support, to see the evidence of any long-term side effects of these vaccines. As of now, within 10 months, almost all the vaccines have, even the vaccines which are, say, let's talk about the vaccines which are not COVID, we all have seen side effects. Somebody will have fever and this and that. So these kind of side effects are still common. In fact, among the major side effects we've seen with the University of Oxford vaccine is that there has been one case of transverse myelitis. That means there's a paralysis of both the lower limbs because of the vaccine. But that has been only one case in more than 50,000 of people who have been vaccinated. So even the FDA and the FDA still have not considered that to be a major adverse effect because only one reported case. Now with the Pfizer vaccine, which has been approved in the UK, even after they've started inoculating people in the United Kingdom, they have found that there's been a new incidence of Bell's palsy. Now Bell's palsy, we don't know, which is a partial facial paralysis. They still aren't able to actually directly attribute Bell's palsy with the vaccine. It just so happens that after they've been vaccinated, they develop Bell's palsy. Whether that is a direct association because of the vaccine is still not known. So these are what we call possible adverse events or side effects that we're seeing with these vaccines. But again, we don't have any long-term data to give a strong recommendation that yes, these vaccines have side effects, these vaccines don't have. But with regards to efficacy, almost all of them are quite efficacious. The only, if we were to put it, the only dubious vaccine would probably be the Russian vaccine because the number of patients in which they were tested is far less compared to the other 3 vaccines.
I can also add on one more thing. When we talk about vaccines or immunizations, for example, it is important to understand that when I take a vaccine, it will give me protection. But does it mean that tomorrow it's going to stop the spread of the disease? Probably not, because we need to have a certain amount of people vaccinated. And for COVID, it says around 60% needs to be immunized to be able to stop the spread of the disease in the community. So so what it means is tomorrow, even if you have a very efficacious vaccine, it doesn't mean that day after tomorrow, everything is done, right? Once we achieve that level of immunization, only then we can see really, tangible steps in terms of reduction in the number of cases. Till that time, we need to be cautious. We need to maintain our our distancing, and this is very important for us to remember.
Okay.
Thank you.
Yeah.
I have a question.
Yeah.
From what I could understand, around 25,000 health workers from Meghalaya who are going to be vaccinated, and in the first phase. And as from what I could understand again from doctor, he had said like there's a possibility of a side effect. So my question is this: are these health workers who are going to be vaccinated, are they going to be insured? In case, I mean,
I'll reply that. See, as of now also, all the health workers, frontline workers, are insured to the tune of 50 lakhs. So now, any new medicine which comes in the market, any new vaccine, yeah, there's always a possibility of side effects. No medicine is devoid of any side effect. Now, when a vaccine comes in, the purpose of the vaccine is to protect. And we believe that our government has put in all out efforts to protect. So we believe in that protection rather than the complication of the vaccine. The protection is more important of the vaccine rather than the complication. Yeah, yeah.
Hello. Hello. During the start, we had seen that the state had adopted a strategy which was behavior change model. Now, if you look at today's situation, it's totally laid back, or earlier they were very cautious and they wore masks and everyone had followed all the protocols and the strategy was there. But if we look right now, it's totally the opposite. Instead, if we look at the behavior change, instead they've turned the other way around. Like if you go to remote areas also, the marketplaces and all, it's all, they don't wear masks. It's, every day, the normal situation. So what do you think? Is it that behavior change, instead it's gone the other way and, they've taken it lightly now and they don't give any, they don't care about it anymore?
Hello. Yeah, I think what you're saying is really true. If we go around most of the marketplaces, or you go to the rural areas, or even if you attend weddings, I've seen, right? People are becoming more complacent, right? They are thinking that this virus is not going to affect them, because if we look at the data also, we have seen that more than 80% are asymptomatic. But again, if you look at the other side, right, it's the elderly who are mostly affected. And if you see the mortality data, more than 10% of the cases who have died are among the elderly. So if we want to stop the transmission of the disease, we want to stop our elderly being affected, I think everyone, it should be a collective responsibility of everyone. And we all know that this virus is transmitted only through droplets, right? So in order to prevent that, we need to wear masks, as DHS has said, wash our hands, and always maintain physical distance.
Ngan ban ni kata mo. If you see from the economy side, you see from the a lot. Now it is within us. Kati hapo ka jungi ba nginya buram yaiwe. Takadaw kasami katu kajing ong nakalyang ka government Kenya ba ngikwa ban buram. Dengan ai fi kan gawai ka exam kan gawai kan uksa. Menci sing yang don gawai bakhlat. Hapo dalu. Uni bakhlat udai ubadon kajingpang yap chiliang. We had one death day before, which we had given the information to the media. And this particular person who had passed away, very unfortunate, he was a hemiplegic. He had been a hemiplegic, udon ketimpang yap silang nado arhajar kat sah. Julele. Usumar biang-biang, haying ru sumar biang-biang. Tika egim ngelong biaiban barbor. Ba uni kunyang jingpang haba uyo bandrung hapo kito ki badang kamsamla ki baklan gamet kapat kamdan kita. Takadang isong asymptomatic but symptomatic. But ini ide ibam laban mi sabar melaban yacu tumar yang bian be hajun tia. Tika egim ngelong biaiban barbor ni test ya ini ni yo positif. Kumba sterik jong December ni yo positif i kendai terik iklan no. Nadu arhajar khat saw. Hadu arhajar arho umlele. Tang sitip sya ba ilong positif kamut kajing kata kalak kata ke yang hibrok hoi. Hadu kajing sumari iru. Bat nangilai wat banyak ba kumnu ni ubri wam jumi na yeng. Ula ban yo yo ni kunyang jingpang. Dai nu khun. Ukhun uyat keleng-keleng, umi keleng-keleng, syang keleng-keleng. Dai nau khun umdan semtam umdan e khun ndai kunyang jingpang udan hau. Upoi hayeng uyo ni pa tang hapo kandai sni uklat. Dikidau jong kajing klat kiri gibabon. Kamdai tang nu ni kunyang jingpang. Kadau sya kabaning kong kajing sumari u. Waila ong positif kamat kajing ting kadang dani wan sumar. Temanta ni wan sa lightly kala poi ke Christmas ni wan sa lightly gi. We have three things. That is 3 C's. Close spaces, crowded places, and close contacts. Yakini ngi haban avoid menta. Na takadaw sami ke SOP play I mena bala ong ba nimla banyat karal. Kini 3 C's now. Close spaces, crowded places, and close contacts. Kini horkit hordang ngidei ban kiar. We have to avoid these 3 so that we get a peaceful Christmas, happy Christmas, and a new year, a bright new year, where we are definite. We are definite. From India, I think they have gone far ahead to develop a vaccine. Once we get the vaccine, we will see. We'll know. We'll get the protection. As Dr. Nongpure and Dr. Rajiv had already said, how long this protection will be there, that we will leave it to the wisdom of our scientists, of our learned doctors, on how long this protection will be for us. But as of now, what we need is to contain this pandemic. And to contain this pandemic, whatever comes in our way, which is beneficial to us, we will grab it. Thank you.
Doctor, I have a question, but it will be in. I have a question, but it will be both in English and Khasi for the interest of the public who are watching this press conference live. One is there are lots of apprehensions right from 13 April 2020 when we got the first patient who was tested positive and unfortunately passed away. Many people, especially those who already have the diseases, they are afraid of going to hospital, saying that if we take the patient to hospital, he or she will be concluded as corona patient, COVID-19 patient. So people wanted to know what is the difference that we have, that doctors and all they have detected to show that so and so patient who already have diseases, they have that specific sign which says, yes, this is COVID-19. In Khasi, kidon buon kijing subas neo na ki babon balang ki ba nong snong ki ong ba ladang idon ki nong pang hayeng kamtam ki reutemen ki bala don jing pang pa ki tieng ban lech sa ki jaka sumar namar habakut en penkut yaki ba ki dei ki bayo pang yeu neu knyang jing pang covid khat khandai te ka ei ka jing ya pher ka ba ki doktor ki lap hang to ban pensisya ba kita ki breu balan jing pang pa ki don ita iwe dak isin ban pentikna ba idei bayo pang covid khat khandai boleh sebut.
Ka jingpang ngan kredensyon Khasi mo. Te kadai ka pi ong pi ba bon nangilay ngim ba pajba hi umetre asyo banwan cha hospital. Wat lada kadawa yaki banwan na kadaw jong kiwe ki jingpang bagidan. Kata it's accepted kalau kadai ka balong ka baja shisha kalau jana do April kadang jah do mentah. Kata ni number 1. Then number 2 pat ngasukwa ban yathu ba pinda pej ya ka jinglong ni jing sitam dai tang hang ni rei keleng satlak jong ka perthai haba ya dai bot u COVID-19 but haba ya dai bat kiwe ki klam ki bola julong haki por ki bal haki snem ki spa snem ki bola dep ni shemba ki hospital ki dai ki jaka ki ba kham khoj bani ka yo ka hat bani ka jaka ki madan ki ba bon breu namar balai Hisian balawan apa hospital, la don lupa ke jingting, kamas, la strict berokhat kita bendeng mas, kat sebapai man ke jakaba, man ke kendong kita ki sanitizer, la tahu jing shit ya berok ki berung apa, ki wash basins ki bon, but ki batrai hang tu ki dei ki brio ki ba ngi hikai na kapor kumno ban, le ya ki ban, ya da ya ladi ya da ki weiru. Haka jo kapor ka jing senret ya gini ki disinfectant kabapun kuat ya ka mariang kabapun kuat ki kenro ya ki biar ya ki madan barokhot ka kham le bnia haki hospital te kabuning kong do banong ba kadon ka jing tieng habawan sha hospital yo na hospital khamtam haba la da pun kre paka la da kat kum bala board kat kum ki protocol jong ka state jong ka government but ha ka ba ngi yadai bat ka jing sistem klam kamut ka pandemic ka balalong community acquired kalau dan community spread te ha jing si shahi ki hospital ki dangdai ki jaka ki bakham khoj bat ki jaka ki bakham long safe ya ki priyo bakinwan ban ya ka balej shayau shahat man ya balej ki jaka bun briyo tadi ka number 1 number 2 pindapet ya ka jing long jong ni jing sistem nadu basedang hadu mentah dan re kata kedak mensuong baik kani kedai ke COVID-19 season pack. Kamut kampau kedak haka seni do, kampau kedak haka X-ray, kampau haka ke bersulong baik spesifik berkedai kani. Hendrai majority kamut palat hendai pau 100% nak kinong pang kiba pang COVID symptomatic ngong ma. Ia symptomatic linginum ya keren. Kata lagi kamut ba pinum pim sungtu hi syuk tamet tapan lum la. Kata lagi jong. Ya kibawan symptomatic kendai pesan kin don jingshit, prapau pesan kin don jerho, but kin kamduna kin don sekajing dap sedem, kajing kta met kta pat, kidon kibaong ba kidja ya kajing sma, kim song thu shu ya kajing sma, but kim song thu shu ya kajing mat, jong kajing bam jong ki jing mat jong kabam. Te ki sitom hakata kadur. Te kibawan ru kila banwan kum kebayong klik banak sedang melumala, but kidon kibawan haduk ba kalalong kum bang yong ARDS, kemud keladai last stage of a respiratory infection. Kemud nak ki jingpang pneumonia, ki kenja pneumonia barokhot, kiwan haduk dalak jankut, dalak sitam Te kata kadai kawai kaba, penlong yaki kaba kumno ni kunyang jingpang u penpau ya lade haka hau beri. Tadi kawai. Te number 2, kaba compare ni kunyang bat kiwai gijat jing sitam, kata banong ba ban ya tip banong ban ya detect pajba, mut banginyawat pajba halaki jong ki yeng kisam ngilahi tang ba wat la kataru ban la pura ka khamjenja. Nomor bani kiwai ki kenyang kani ke jing sitam kadon kawai ka jinglong jongka ba ki beriu ki ba ke oksigen ka ba kiring mensiam kamrung sakasnam kiwai ki jing pangru ki don ki balong kumta ndrai sisien ba kamrung ba ka oksigen sakasnam la dadai ka pneumonia ka ba siyo abor menchwa dadai kata kamut daduna oksigen tang melumala oksigen saturation ka bang yong daduna tang melumala ru ngila suthu ngila dap sedam ngila thaj ngila leng a ting ki brio kim tip brio shu kila keren klumar hendrai habaya dai bat COVID-19 kata ngimyoi te kadon something bang yong silent hypoxia kamut ki brio ki tangan ya ka oksigen kim yo ka oksigen ka ba kadon kam kamet hendrai kamet pat kampen pau ba ngadon kam oksigen te namar kataru bon kinong pang ki khen sting ya la ka jong ka jingstong khen ba o nga don jingshit ngajar ho melumala ngadap sedem ringam pat sung thu papang te kat ba kindala sung thu ba kapang ka oxygen saturation kiladon ki ba poi hospital kalap jakab kandon 96-97% haki kiladon stang 37% te kata kalalong ke ka ba ke ba jenjar yang ginong sumar lada kilawan haki dalawan hak condition ke bala hamlong serious te ngatrai ngala jubab ya kita ki artli ki point ba ang pi ban summarize kawai kedai omdai bantiang banwan chi hospital namar pindapet ya ka statistics menchim snap apo ri India jongi ki bayap na jingpang sini na jingpang BP jingpang stroke jingpang heart attack kila poi 50 million menchim snap mentau snap now covid kila yap silak lai pho hajar lai san hajar kumta te kata ngalong mdai bungong ba mdai bantiang yo covid hendrai ngidai ban song thu ba ngidon kiwi jing sitam ro ki sitam kampalat susu ban yo covid te ban kiar ya ka jing ban kiar ban wanwat ke jing sumar na ki hospital halor ka ba nalor ba kamdai ka ban tiang ha bala pan khoj ha te ka long ka ba sngosi ngidu ai bon ki jingem ngiladu bon ki jingem na ka daw ba ki tiang ban wan hospital ki wan tang hadu haden do tang kata
English. Okay, you can English.
Hello. Yeah. So with regards to the clinical symptoms, that whether there's anything that's really specific for COVID, clinically, without any investigations, is almost impossible to distinguish COVID from other respiratory infections, respiratory viral infections. Though COVID may have certain small, very soft pointers towards it. There's a phenomenon known as the happy hypoxia, where a person becomes hypoxic but may not show any signs of the obvious. So there's why it is always impressed upon people that the moment they have symptoms to check their oxygen levels, because sometimes they may feel absolutely fine, whereas the oxygen saturation may be dipping to the red zone of around 92, 93 or less than 90%. Otherwise, without investigations and without a confirmatory test for COVID-19, it is very difficult for even any a learned physician to say, without any of these investigations, to say that the person has or has not or doesn't have COVID. And all the more so now in winter where it is the season for someone to have your flu, to have your other respiratory infections. So it is very difficult to distinguish COVID from these other respiratory infections, viral infections clinically. And with regards to the fear that the patients have in coming to the hospitals, for the fear that they may contract the virus from the hospitals, it is actually, to put it factually, actually, when we look at it, the hospitals are in fact one of the cleanest places, so to speak, especially now when we have the community spread. Because when we look at it in the hospitals, there is a tight adherence to all protocols. We're looking at hand hygiene, the 5 steps of hand hygiene. We're looking at social distancing. We're looking at use of masks. So all these are very strictly followed and enforced in hospitals. That is basically to ensure that the patients who come or the health workers also, the disease does not spread in them. So in fact, when we look at it now we're in the midst of a community spread, I think the hospitals in fact are one of the safest places, the cleanest places where one can come. So if for the fear of COVID, one really need not abstain from coming to the hospital, because looking at our country, there are still a lot of other diseases which are far deadlier killers than COVID. And because of COVID, we should not lose patients dying of other diseases, dying of heart attacks, dying of diabetes mellitus, dying of COPD, just for the fact that for the fear of COVID, the family members, the relatives, they don't want to take the patient to the hospital.
Thank you. I would like to say something on this also. Now, there are many families which have expressed dissatisfaction with regard to the relatives being taken to the hospital. Some of them, unfortunately, I think you must have heard that have happy hypoxia. You have comorbidities, you are an elderly, you have some symptoms at home, but you do not want to take them to the hospital until it becomes fatal. You bring them to the hospital. But in some of the cases, by the time they reach the hospital, they have already expired. Now, as what Bahraini has already said, you cannot clinically say that this case is COVID just by seeing the patient or by examining the patient. Our diagnosis will rest on the tests that we conduct. And for each and every case which we have labeled them as positive case is because of the tests conducted. Number one, we have a protocol. All cases coming to the hospital will be tested. That is one. Number two is that if from the history that we take, there is every likelihood that a person may have contracted COVID-19, then we go for that test. That is why, till now, we say that we have come to the conclusion or we have come to the diagnosis based on the tests conducted. Yeah.
I have one question. Can you hear? Doctor, what is the price of this vaccine in the state, and will it be covered under MHIS?
See, the price of the vaccine has not come in the market as yet, so I will not be able to say what is the price of the vaccine. That is number one. Number two, MHIS is there to take care of the health coverage of the citizen state. We will definitely take a call to see to it that it is covered also under MHIS.
Doctor, gawi ke jingkali, kai ke daw bagi babon ki positive case sa Italia. Kita ki asymptomatic ba kabapendong yi ki priu bagi nam tieng shu yu ni kunyang jingpang bagi khamtam sinong kendong ki ong bai bodai buyong khle. Ba ki ki lat ke ba katanat ka koi ka khia kan le khamtam ha kini ki ayam ki badai ki ayam le kemen Christmas pat sem thmai jong ki priu. Bagi priu kin so tho wa ni kunyang umpat ko thodo menta.
nakalian ka testing, nihaban kan siya pi, baka PCR test kabangile, mo kata ka molecular diagnostic test that shows that a patient has COVID-19. Kani ka test, it has certain limitations to it. Kani ki limitations kilong, a person is PCR test can detect minute quantities of viral RNA, but it cannot differentiate whether the virus is infectious or not. That's why we will give you a positive case for COVID-19, but we're unable to tell you whether that person is infective or not. Nakataka daw piyo ikitukin. Kiba piyo positive, ti piya kali padakin. Kung no nga ngayo positive, imay klamiyo, ipay klamiyo, bahiyang klamiyo ngayon doon lang. It's improbability, niyo COVID positive ito, he got a non-infective virus. Tiban kung no bangintip baki virus kilong infective na kimlong infective. Kata ngi haban le viral culture. Ti ya kata ngimpon la ban le hang ni hade hapo state jungi. What hari India jungi ru namar ba ka jet test ka bakhamlong a little more difficult. It needs more technology is much more higher. We'll need a BSL-3 lab, which we do not have, and plus if we see that it's a pandemic, not every case can be taken and done for viral culture. Te nakataka daw pidi man sungu tu ba ladangi ai COVID positive yopi. You may be infective, you may not be infective. That's why people can infect others, people not infect others. Pilaban ong banga shuya nga ki ai positive nga kham sungu i nenga kham long i nenga kham yo symptoms nengam doni i tika taka daw mo. The PCR tests are useful if you understand the limitations of the test.
Ngan jawab saya ita aja ka jong jawab mayan dia no. Ikili yang ba bon kimda le saliasho. Sepang ya kani ke Jepang namar ki ong bon bagalong kum ko biong kli ha ka de kita. Tama bale ngi sawan de kini ki protokol ki SOP kan ni teli. Kawai ke jing affair ba ni khnyang Jepang kalong tanggani. Upur step ba. Bat lada upur haki bakhan gamet kam dan jikta. Kalong ngi kum ko biong kli hendai lada upur haki bam khan gamet ki badan de ki wi Jepang ta kamot ka penstam pada ki halor ki Jepang. Tiban ong ban le bam salia namar kalong kum ka Jepang biong kli haduk mentahi kampat de kapor. Nginget bakalom ko biong kli bangi jam kloy dan ngi khan gamet. Hendai ka cu kapor ru ngipet ya ki jingja habaro ko ko perthai. Khamtam syagini giri bilat. Baka jingkta jong khyang Jepang but kajing yap jong gibreu kadai ke dak ke bubu jingkeli yang ihang ni ru bat kadai ru kajing maham ba kampat dai kapor ba ngin le bam salia bat ngin le kamkai yau ni khyang Jepang lada kadai kumtahi kalong ke Jepang bayang kli ya ki bakhlan to ka biang ngiru ngimrat dawan ban penmi dan dia ngin ekran sepang ni khyang Jepang dan dia ngin penmi kini ki SP kan teli ngin penmi kini ki adong kan no teli sho lada nakaliang ka jongi ni sotho ba kamdan jikta ndai bangile kini ki barkhat ni sotho ba kadon jikta pada yaki wei ki patalat kamet dikumbong doktor meban to yau ni khyang Jepang namaru pur step ula ban kata ba ya ki babon ki badan Jepang di ki wei pat kung yang comorbidities ho ngin concentrate ba yu ni ai importance ni khyang Jepang dai ka ju kapor ngim klet pada ya ki wei ki badan di ki wei ki Jepang hilai hi katus ni ngilai i kini ki badan lupa ki Jepang cancer haki kumno bu ni khyang Jepang kata wei ki layo kemot kimsha dena takada ngi song what can bam salia namar hot ki bakhlan gamet piang kadai kum ka piang ke Jepang biang kli ki bam khlan gamet pada te kalong palat ki Jepang biang kli.
Doktor sekawai jingkeli doktor ini just doktor abangi ki beri complain bawan rong sport kastil yang bang irung apa entry point yang ti dan ngi test yang ngi dak yaki dak rapid antigen test ki hablej bande i go home quarantine sung ba nyos ngi ka ai pat ki pair ba ki tu ki bawan ra de ki report na ki antigen da ki sibanat test ini ki RT-PCR test kim don kam chu bande i go home quarantine.
Kanika rat test kabopi ong fika rapid antigen test has a false negativity. More accuracy jo kanika test kalong 50%. Only 50%. Nakataka daw, we asked them to quarantine for 7 days or whatever the state government is saying. This is because we want to slow down the spread of transmission. This allows for a person, if he is negative, he may show symptoms within 7 days. However, with a nucleic acid amplification test, that is the PCR test or the TrueNat, CBNat, whatever you're saying, these are true tests. That means they will detect the RNA virus if it is present, unlike rat test, which has very poor accuracy. That's why we say that home quarantine is necessary for at least 7 days.
Kat sakawi kita bunyi ong ni ba quarantine ki bora certificate ku mentala de kiwan ki ora tu certificate kamot kim dan kam test hang te po entry point. Ndai la ki sa palat sang singi hang ni ki haban test biang ni. Kita wara kan no certificate.
So I'll just add. I'll just add with regards to the rat test. Rat test is highly specific, is very poor sensitivity. If a rat test is positive, we are 100% sure that he is positive. However, sensitivity of that is very poor. If it is negative, that still doesn't mean that he's absolutely negative. There's always a chance that this thing, because the rat test, the mechanism of the rat test and the PCR test is fairly different. The PCR test actually detects two separate genes. It is the PCR test, if it is negative, that means you're sure that the patient is negative. Whereas in a rat test, we cannot be confident of that. So that is why once here one rat test is negative, we still have that cushion of caution where we tell them you quarantine, because in those 7 days that they're here, usually we say that we take the incubation period of the COVID-19 virus to be anywhere between 5 to 7 days. So that's why we tell them to stay for a period of 7 days in their house, so that within these 7 days, if they show symptoms, they have to be tested again. We cannot rely on just that RAT negativity. So in that 7 days that are in quarantine, if at any time they show symptoms, they have to be tested again with an RT-PCR, not a repeat rat test. Mucormycosis is not a rare fungus. Mucormycosis is actually quite common and is very common. It commonly affects those who are already immunocompromised. We see mucormycosis very commonly in diabetics, uncontrolled diabetics, where it tends to affect right from your nasal sinuses, your nose, your nasal sinuses, all the way down to your respiratory tract and your lungs. You see them in the post-chemotherapy patients. Okay, it's a ubiquitous virus. It's a ubiquitous fungus. Actually, is found everywhere. The only problem is that in healthy individual, immunocompetent, they already have the system to protect it. Now, I have not come across the case of what you mentioned, that the mucormycosis in a patient of COVID-19. Though I would suspect that if probably we go into details, he would definitely be immunocompromised in some way, either an uncontrolled diabetic or a cancer post-chemotherapy. He would definitely have some form of immunodeficiency. He would be having some form of immunodeficiency for him to also have mucormycosis.
Yeah, and what we are asking, whether we are prepared for that. I think treatment is very much there, and we can manage accordingly.
Mucormycosis, the treatment is, there is standard treatment for mucormycosis, which is available, which we have been treating all this while.
Yeah.
There's a question here that you've mentioned. You would like to know how much fund civil hospitals now receive from the government and other institutions for COVID-19?
The fund we received, we got from Power Grid 82 lakhs, and that was utilized, 100% was utilized. And then we got from NIHM, from the mission director NIHM, total of 48 lakhs 32,960. And then again we got from NHM with 4 lakhs 50,000. So what civil hospital got was 1 crore 34,000, 34 lakhs. So far we have spent 1 crore 29 lakhs, and right now we are having only 5 lakhs.
Yeah,
23,000.
and that is a specific fund which civil hospital has received. Now from the state, civil hospital, as like any other government hospitals, we have been giving from the state all the requirements which they need, as is being given to the other hospitals. This, what he has mentioned, is the separate fund given specifically to civil hospital by certain organizations.
Doctor? Ngayon na po, power grid, 82 lakhs. Kini kila utilize pero mga dang shoe join kila yo ano pa siya mga join. Dan ayo na NHM. Na NHM meaning ki pun dah kabang kadi jong ki staff, jong ki patients, jong ki staff. So pupalak na ko rajar ndai span ruko. Tingi yo abiang pada sa saulak san ko rajar. Tebor khay ki bara receive kolong 1 crore 34 lakhs. Temga pendut kolong 1 crore 29 lakhs. Dan kabasa sanlak apu lai hajar. Te yakani lu ngidang bun ki bills ki bangi dang sahib ngin hapsiu nama bun ki dawai ki bangi dang kam kensan steng miet ne yung sia taya bat kan mesti ni ban nang bun ki bil bangi nang siu. Te yaka building pitip covid ngimdam separate building ngas pun kelai kan sewing sia ka covid building. Te apa covid kan sa building ka he kung gani ka hall tingi happen nawang ida kam isolation tingi bu ki kamera barit again to ka jinglut ka bun nasa gitu kanya cha na support DHS health engineering wing te kini gide ki jingyo bangi yo adu menta inde kidang don bun te sa ka oxygen kidang bun ki bil ki ba yang sa mo ta hang tingi abi de ki central oxygen supply ti ki bam oxygen ba te jinglut ka khambun turu.
Doktor, nilai minta sepuluh benai buat dia COVID. Masih kuat abantim, kumki medical professionals. POE kumno hakini sepuluh benai kata nado April hadu minta kadang anything improvement ne kalong vulnerable kani kajing infection. But ngan mudban keliru kumki medical professionals POE ne makan don kata ka second wave of infection.
Second wave.
Halo. Ngatrai kat kum ka jingpet jongi nadu ba sedang hadu menta. Hakini ki sngi ki bala adap ngi ba kila sedang dunahi ki case compared to the previous months. Tangba kumbang laong benne lada ngidang ya kensting but ngim follow ya ki protocols ki kendon ka ba ka sarkar ka bala kala bu we may expect a second wave.
When we talk about infections, we need to understand there are two things that is needed for an infection, someone to get infected or the disease to spread. One is people who can be infected, and one is people who can infect others. Right? Now, what has happened, as I said, as we are discussing about, and there's been a lot of discussion, you would have heard about things like herd immunity, which has been discussed a lot. So in Meghalaya, the good thing has been that we have very little number of cases. We have been able to largely contain the spread into certain areas and not widespread as, for example, let's say in Delhi or some other place like that. But that also means that there are vulnerable people who can get infected, right? So if we loosen our guard, if we put our guard down, there's a possibility that again, there will be another thing. And that is what is happening also in some of the European countries. We are seeing that they decided to go back to completely normal life and then there has been a resurgence. So there is always a possibility. But as long as we follow our protocols and SOPs and we are maintaining the 3 norms like hand washing, maintaining the physical distancing and wearing a mask, I think we should be largely good. Thank you.
Doktor,
Asuat dia doktor. Hatu kini kejing hiat jong kini ke kram. Kadai na kadau bag sarkar ka kram tengshu ban le ka random test bat na kai kadau ko sarkar ka kram le shu ka random test kham tam ha ki yo ki hat.
hakini gisngi mal adab kidan bun ki jaka ki bangi la ya ka random test but ngim shu la ya ka random test hakino kinu ki jaka ladangi yo ki cases ki ba palat laingot hadu khatsan ngot kamut lada kidan clustering of cases hakano kono ka area ni decide ban la ya ka random test te ngile kumno ngi identify ya ki breu ki ba long kam vulnerable ban yo ya ka infection kum ki bala kam yaw ka rata ki ba palat ya ka 100% ki badan kano ka symptoms lane ki high risk contact ni identify kum kita bat ngi test ya kum kita hi namar ngiu iba menen ru ngidang sula random test mentas ngiru ngilale random test sya kidan ki area kum sya madan rating arpusan ngot ngila random test bro arpusan ngot hi ki test negative te ngatharai ka infection kala kham dunahi but ki positive case ki bangiyo ki dai tang ki tu ki badan link but ki bala positive lupa ki high risk contacts tang hakitahi ngidang yo positive cases
ngan chu pasat khandiat halor kata benta kumo ngi ba John ba ya kanika second wave search ka second wave kanumuan ladangi ngi fikir hilati ka second wave kanwan ladangi fikir kamot ngin habi keno hi yaiwe kanwan ka second wave but kumo ngi ba maya pada ba kiduna ki case namar ngiduna kajing le ki test hapor ki banai ki ba dang sedang ni covid ni test ya bar khat ki bawan ni syam ba kini ki mengites kan mengites ki babun ki bawan ki bawan return ki geru ki babun ki kini ketep sudah kini kata ya kajing don jong kini ki tiar test ki jong ki kits na kata-kata mentangi ngi ong test bet shwa kumong ba Robert Dr. Robert ba ya gitu ki badan symptoms but iki high risk ni concentrate pai gini te what tang ba test ngi kini ru ngi dang yo kan ni teligi positive ti ya kajing bom test ni ya kajing wan jong kajing jinglong jong ki bre one test tinga ban yang sai sisim ba ngini buram yei bat ke protokol ke lightly ke ngila da bong ketangan ong biang ba findangi gi mas hakpor ba fidei bandangi gi mas hand sanitization ban khot yikti ban sat bahai kiti ban le khot but ban ne penjengai we physical distancing kini gidi gi we ban ngala at mane sa lightly kisi ke wan lang ha kaju ko por ke jingle ke menjungi Christmas crowded places close contact but close spaces ya kita bagi dai ban fikir na
ngalong ngan at ka jingkeli jongi ba iba keli mentan ong kai ka jing syam jongi ba ngila ya ling bai gini ki shpo banai ni nakaba ngila yo i bang ngila sumara ginong pang ta banai ngi syam ba ki brio jongi kila ban gele persya ya ka jing stop kabamut wat du jing kermen babon ki bawan wat ki temen propose house nem ki brio ki badan tor tang siliang ki badan sini ki badan cancer leukemia ki ba layo stroke ru kidan kita babon balang hi ki koi te nakaliang jongi ki ba yo i hi ya ki nongpang ba yo i hi bada sumar hi bada yo i markhamat igi nongpang te jingkerpa nakaliang jongi kalong number 1 ki brio jongi ki don ye kata ka jingele nalade ba kamet jongki kadang la bang le persya number 1 number 2 wat judo jingkermen but number 3 ke bang yo i kalong smau bha wan kloi chaki hospital da pipa om dai ban le ran namar kam dai ke jingle bakla haba pio pang covid om dan balik bakla om dai ba ka pop jongno kadai ke jing sistem ke baya bet shu ta khndiat la ya bet te jaka ban le ran ban ngang dan covid ngi dai ban wan chakmat ban ladang dan jing per smau bha lada long ban test lei lada dei ban test lei dei ban test udut tenang ba kijing ai sumar kijing sumar ngin yo ban le kloi te kata hi ko bangi syam ha kijaka bangi sumar ya kibrio ki bawan kham kloi ka kham suk ban sumar bani kibrio ki bawan kham slam te kata ne lang pa ban ban bless you
in one go. In one go, at one go.
Again, Kato, it'll depend on the type of mask. There are certain those high-end, heavy N95, N99 respirators. Kito, you advise 6 to 8 hours. And that is for a healthy person. Yekito lagi badan kibaladon sistem lagi sedem kibaladon maybe asthma or COPD lele balakam telat ke bor sedem juga balakam telat. Then for them, it is advisable that the moment they feel slightly breathless, remove the mask. Remove the mask. But again, if you have to remove the mask, do not do so in a public place. Be alone. Make sure that you are following all other protocols of hygiene. You sanitize your hands before you touch your mask and all. But for the normal 3-ply and all, there's no clear-cut guidelines as to how long. As long as you're comfortable, you can wear it. But you should discard your mask, especially if they're single-use masks. Discard the mask when they're visibly soiled, both from the inside, maybe you're soiled with jingkarka or your saliva or anything, or they're soiled from outside. Then if they're soiled, you have to discard away your mask. Okay?
Bisa belum ada mentah. Kani ni kalangom ni. Kani ke statistics kamu haban sim lagi hospital, naki entry naki mentang anu ngamdan ni kata ka you. Tama lum tinggal alum kambu ni, kamtam naki entry nama ki haban siu bagi bisa. Ndai kenal kani koi, kajing siu bisa ka dai betang gitu ki bakwa aban test ki voluntarily. Ni sim bisa. Ya gitu pada ki bangi pa mangi. Naki hospital dan naki bor ki pada jongka tenat kekuat kakia, kemudian lagi di high risk contact ni fates ni kim happen sih bisa itu. Ngi pet ya kikis ki bangi tes. Tengim ong bangi lahir kikis. Takarang ngisa ong ba ngi tes katangut, nagi ni bangi tes ngi don katangut ki balong positif. Ndai kumofi ong mofi ladang ites tu baru khot ngi laban yo khambon ni kata ngim laban lani na kata kadau ngi saong ba ngi don kam ya kini gi lightly protect ndai nomor lada sibuk fifim non virus ngam non virus le yung ngandeng kai mo ladang so tu kata ndai bangia khenni ladi we treat one as a positive case. That is why we are taking all these precautions. Te kaba kongsan kaba fiang fi hot larang ites so berkhot ngilak ban yo sibun kikis ndai ngi haban perkhat dai gi logistics e gi mangidan mangido haka juk por bar manginum pele no ya gini gi logistics mangidan namar haka no kapor kaba ngidon kami kini ngi dai bandan lupa kini gi stok ki jungi te saisin ngan ban biang mdan gi wei pare kaba ni dai ngi tang lai teli gini gi ju hi ki mangi ban nadu ka mas nadu physical distancing ban sajikti, ya kiti pun koi hand sanitization, pun kami ki sanitizer lada don, dari tang kasabon, buat ke ke bah duit, fintat kata kalap yang.
Naka jing pet jing po hospital ro, lada dai hiba naka jing duna jong kates ki ki drop ngin jendela yo bon ka jing yap ro, bon ki beri jendela shuyap hayeng kum tu kamantes, rekat ki tes nomor sin bon ra broad dead. Kita bawa rak kita layak berpan yang kita bawa rak hangi kendian ngut kita don kita long positif hendak kita buat hi kita long negatif kan mantan ngadang semi in hospital mantan siapa nganon sini udah min hospital bukan broad dead kuda negatif mau tengi tes hi kini kita broad dead dan lada day hi baki jap ki covid patient hayeng jendela yo bun ki broad dead cases kan kita positif nah saya kata luka indicate kendian bah ngim ka dead rate hi ka duna.
Tangilai biang try komentar sih. We have come to the end. Yeah. Yes.
Vaccination. Of the vaccination, how are you going to convince people to take the vaccination? Because you know that people are doubtful about all these things, and they have always been, especially in Meghalaya, they've always been, insecure about vaccinations, even in the past, about all these ordinary vaccinations. So what are the steps you're going to take to convince people? That is one question. The other question is that, do people have the option of saying no? Even the people among your health workers who have been identified to take the vaccination, do they have the option of saying, we will not take this because of the risks that have just been talked about by our doctors? So these are some of the issues that if you could kindly highlight.
Madam, on that I will just go back a little bit. When we were just joining service at that point of time, this new vaccine had come up for infants, and that is the measles vaccine. It was so difficult to convince the mothers because they feel that if you get the infection, naturally it is more protective than the vaccine itself. Then we have seen this home delivery. Many mothers at that point of time also, they feel that delivering at home is a much, much better option for them than to get them to go to the hospital for delivery. Now from this I will tell you this. In the course of our clinical experience, we have seen many cases of measles. We lost many cases because of the complications. And in the course of that, we go for awareness campaigns. And now people have accepted measles vaccine. They come forward with measles vaccine. Likewise, for home delivery. There are many cases, delivery is a natural process. And if it goes naturally, comes out naturally, you'll come out fit and fine. But if there's a complication at home, it's difficult. So now people also are responding to that and are coming forward, although we still have a long way to go. Likewise now, for this vaccine, when people see the beneficial effect of this vaccine, naturally they'll be convinced. For any new thing which is introduced into the market, even for us, a new drug, we have our reservations. But here, because of this pandemic, we have already spread the awareness. We have already activated through the district administration on the safety and the efficacy of the vaccine. When it comes, and voluntarily they will come forward. I'm saying voluntarily, they will come forward. If it is beneficial, then I think it will be acceptable. We have to go by that for now. No forcing, no coercing. Okay, I think we have come to the end of this. Yeah.
One last question.
Yeah.
If we try to compare from the beginning and now, when this COVID situation had taken place here in our state, people were disciplined those time. I mean, like from March, especially when the lockdown was imposed, but they are not disciplined now. So you mentioned those 3 C's which people should avoid. Whether you will only appeal or it will be enforced.
See, we have got the 2 acts, okay? Enforced now, Epidemic Act, we have got the Disaster Management Act, we have enforced that one. Now, for us, it's always a better option that we cooperate together, we work together. No coercing, no forcing anybody. But if it comes to a situation where we cannot control anymore, then at that point of time, putting in place the provisions of the Act and enforcing what has already been passed by what has been passed as per law, that we have to take into consideration. And once more I will mention here that we have been successful all along because of the cooperation extended by all concerned, especially the Ramba Shnongs and the Shnong, with the district administration, with the health department, police, I mean, all the government departments, and especially so from the members of the media, the press. You have done a wonderful job for us. We had so many press briefings, and you were always so cooperative. And I think what had percolated down to the citizens was the way you have helped us in this management of COVID-19. I think from us, the doctors, we give you, we salute you, and I think they deserve a big clap regarding the media people of Meghalaya, how they've conducted themselves all along this pandemic. Thank you. We have come to the end of this press conference. The next press conference, we will inform accordingly through the press club. Thank you.
Doctor, thank you. But last and final question. The Chief Minister of the state was tested positive. So how many contact tracing you have completed?
So far, what we have completed, who are very high risk, that means people who are likely to be positive, 28. 28. No, see, I think that is not for me to reply, but the only thing is that there are many people who meet the Honorable CM. It is not, I think it's not only politicians, it's the bureaucrats, it is office staff, then people from various NGOs, people from various Shnongs. So I think what we have done is that the people who are very close in contact with him, we have taken them into consideration first. And so far, no one has turned out positive, so far.
Doctor, what about his family members?
I mean, if I say people from outside, okay, the people from outside are being tested, then naturally family members are already there. Yeah. I beg your pardon?
What is the test results we want to know?
I think for that I'll be able to tell tomorrow when the results come out. Thank you. Bien. 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 Okay. Next will be live with the people. They will ask. People.